Welcome back. Acceptance and treatment of mental health and behavioral issues has been at the forefront of discussions about medical care for years now. But today, the state of Florida is at a crossroads where action must be taken or the need for care will simply overwhelm the resources that are available.
State lawmakers have poured funding into expanding programs at state colleges and universities to train the next generation of behavioral health professionals, while those already in the field are looking for ways to mitigate burnout and keep people from leaving the industry.
This morning, CBS 12 News reporter Stefany Valderrama is looking into an issue that some worry is keeping qualified people from being able to do their part.
I myself have been in long-term recovery for over 24 years.
Susan Silverstein Knee has firsthand experience of therapy from both sides as a patient and a provider. After decades working in the fashion industry, the New Yorker got her master's in social work in 2017 and moved to Florida to pursue her new career.
I've been working in the addiction treatment space since then, where we treat co-occurring mental illness and addiction.
Along with her advanced degree, she has years of experience in multiple professional licenses. Now, the one thing Susan doesn't have is a clinical social worker license. That credential would allow her to move up in her facility, provide outpatient care, and even set up a private practice. Problem is, she can't pass the exam.
How much time and money you have invested into getting this certification?
A few $1,000s. Time, a lot. I've been trying to pass this for almost 4 years. And you can take it every 90 days, but every time I take it and I don't pass, it just sets me back emotionally.
Now, her story is not uncommon. In 2022, the Association of Social Work Boards put together this extensive analysis of data collected over a decade. The information is all self-reported by test takers, so it isn't perfect, but it does provide a picture of who is passing the tests and who isn't. The good news is between 2011 and 2021, the number of people taking the test, which has different versions for clinical, master's, bachelor's, and associate levels, has steadily increased. A positive sign people from all backgrounds and age groups want to join the field, but the overall pass rate is less than 65%. The analysis also determined more women pass than men. Young people pass at a higher rate than older folks, as do those for whom English is their native language. Black test takers fail at a higher rate than most other groups. So that led the National Association of Black Social Workers to demand change to address the disparity in pass rates, to remove the institutional barrier, which it said was not the fault of the test taker, but the testing process. Stacey Hardy Chandler is the CEO of the Association of Social Work Boards, which administers the exam.
It's certainly issues that are impacted by systemic factors need systemic solutions.
Is there anything being done to help certain groups be able to better pass this test?
So first of all, working with educators on the other end of the spectrum, working with the advocate component of the social work profession, we have to work across the profession in order to be able to see any differences in these disparities.
Chandler tells CBS 12 News data collected from the 2022 analysis identified issues which will ultimately help test takers and improve the exam. And she adds the ASWB has a number of study guides and other initiatives to help test takers. But she points out the test is rigorous because it should be.
The items are designed to test critical thinking and decision making. And the examination is about here is a general situation, again, entry to practice, what you should know day one as an LCSW. Here's a situation based on the information that you have available, which of these options is the best under these circumstances.
Every 5 to 7 years, the exam is revamped, and a new version will be available in 2026, based on data collected from more than 26,000 practicing clinical social workers in the U.S. and Canada. Susan has hired tutors. She's done the study guides. She's put in the work. Now she's out thousands of dollars and emotionally spent trying to get this license.
I feel because this is my second career, it's been a little bit more challenging. At some point, like how many times is someone gonna keep going?
Now this exam is for the highest level of licensure in this field with the greatest level of responsibility for patient treatment and prescriptions. And as Hardy Chandler makes clear, failing doesn't mean you can't get a job.
But you can practice without it.
Correct, yeah, so you can practice without it because if you work for a facility, you're under the facility's licensed.
Yeah, so in addition to getting a degree in this field, before you can actually sit for the exam, you also have to complete supervised clinical hours. That can certainly be another challenge when trying to pass this exam. Now, Susan tells me if she could offer one suggestion, it would be to allow students to know what they got wrong when they fail. She believes that alone could improve pass rates. Now, in a statement, a spokesperson for the board who administers the exam tells me that's currently not how it's done, but it could be something that they consider in the future.
Hi, I'm Matt Lincoln for CBS 12 News. Click the like and subscribe buttons if you want to see more stories like this that impact you.